This information is for educational purposes only, does not constitute legal advice, and does not create an attorney-client relationship. If you need legal assistance about a legal problem, contact an attorney.
What causes burnout? So, there's 5 or 6 causes of burnout, but one of the big ones is, generally the work volume becomes so much that you're having to take things home, you're having to stay late at the office, you're having to come in on the weekends. So the actual volume of work with the paperwork and the computer work that we need to do with electronic medical records that is being mandated these days from the insurance companies to get paid. Mm-hmm. It takes a crew of 6 workers in the office to see a patient that comes in just to have earwax removed. So when that's the case, the paperwork multiplies and our work multiplies.
Absolutely.
And before long, you realize that you're doing more non-clinical work than you are seeing patients, which is no fun, frankly. Yeah. So the volume of work being excessive is one cause. Another cause is what we call a loss of autonomy. So, again, I spent 13 years training for this. I've spent another 5-6 years in private practice. I feel like I'm an expert in my field, yet I'm having to argue with someone at the insurance company as to why this patient needs this medication or this imaging study or whatnot. So you get to a place where you don't even feel like you're the one calling the shots with your own practice. That's very frustrating to have to deal with. And so, and then coupled with just the electronic medical record, constantly new coding coming in. There's just a lot of non-clinical work demands that just pile up, and it just takes the enjoyment out of it. At least it did for me.
No, I can absolutely see how you went to school to be a doctor. You didn't go to school to be an admin. You didn't go to do paperwork all day. So yeah, I can absolutely see, and just the constant changing of regulations and rules and what's expected of physicians on paper, it is constantly changing, and I'm sure that that's difficult to keep up with, and just kind of you've got to keep your head on a swivel, and that can absolutely burn someone out very quickly.
Our nature is, not only do we not ask for help, but we're not big complainers. Right. Physicians in general, and most professionals. I'm saying physicians, but this pertains to other professions as well. But we're just not big complainers. So we let things pile up and pile up and pile up internally. So not only are we not asking for help, but we're not even complaining or venting. We don't generally have an outlet that we feel comfortable to do that with, because, let's be honest, the general public doesn't want to hear doctors complaining, because the perception is that doctors are rich and wealthy and right. and everything is perfect in their lives and everything. And so the last thing that the general public wants is their doctors complaining about not being paid enough or having to work too much, And so that kind of leads to some isolation, so to speak. So again, it's kind of burnout is a perfect storm of issues coming from every direction, it seems like.
Know Your Regulator, the podcast that inspires you to engage.